Good morning, all. Today we are going to talk about facial pains, types of facial pains, termination of facial pain due to some other pathological issues, and the type of other pain which are getting associated with facial pains. So first we have to understand that what are the facial pains, what are the basic causes of facial pains, and what are the relieving factors for the facial pains. We have to understand the basic mechanism of facial pains, nervous system of facial pains, and the anatomy of face. So for that, we have to understand that our face is divided into two parts, left one and right one. We have to see the basic musculature. We have to understand the basic musculature of the face. Muscles are originating from skull to forehead, cheek area, jaw area, and neck area. So there are so many types of pain, but we will discuss here TMJ pain, which is also known as temporomandibular joint pain, facial pain, sinus pain, headaches in only front compartment, because we are not here going to discuss about headache in detail regarding or accessory related to the facial pain. Sinus pain is related to the nose area or the area which is related to above the eyes. Eye pain, orbital pain, or nearby areas, cheek pain, neckline pain or jaw pain, or neck pain associated with ear pain. So we have to understand the basic phenomena of the facial pain. First, we will understand the temporomandibular joint pain. Like what is temporomandibular joint and what are the types of pain we feel in TMJ pain, and what is the identification of TMJ pain. So in TMJ pain, there are so many reasons of TMJ pain. First is your bite. If you cannot chew properly, your bite get deviated, your face get deviated, and your joint of temporomandibular get affected. It could be due to degenerative changes, due to aging process. It could be due to any injury, or it could be due to any dental treatment. So by dental treatment, patient get pain starts from here and radiates through front side and radiates to neck and the neck area, sometimes in the arm area. So this all part is related to TMJ pain. Second pain is trigeminal neuralgia. Trigeminal neuralgia, we have to understand the trigeminal neuralgia by this picture. I'm showing you the picture. This is of trigeminal neuralgia. It is a nerve trigeminal which is supplied by main trunk and supplies in three zone. First is trigeminal ophthalmic zone. Second is maxillary zone. Third one is lower mandibular zone. This third one zone is related to TMJ pain also. So in this, we have to understand the zone and their types of pain and their home remedies. The remedies by which we can get rid. But we have to understand the mechanics it correctly of the facial pain. Next is the facial nerve pain. You can see the yellow part of the nerve. Yellow part of the nerve is supplied behind the ear and supplies on front part of the eye, and second part trunk's second part is supplying in face area or center of face area, and third part is supplying in lower mandible area or the area which is near to the jaw, or you can see the jaw line. So these are the basic areas of the pain in trigeminal area. Trigeminal area is basically supplied by their muscles and the main trunk of the brain. This is very common pain, and this can be treated with some medication given by a neurophysician and basic exercises of tender point releasing. In trigeminal nerve pain, we see the ophthalmic zone pain and maxillary zone pain. These both zones are very prone to light sensitivity. These both zones are very prone to the basic exposure of the face area. And third one is chew area, or we can say the TMJ area supplied commonly. So this TMJ and trigeminal pain sometimes get affected or combinedly or with the accessory muscle insufficiently in the zone. Now, we have to understand the zone and their treatment individually. So, first, we will talk about the basic zones of the trigeminal neuralgia. What is, we are not going to talk here that what is trigeminal neuralgia and what are the causes. If you have been diagnosed with the trigeminal neuralgia, so we can get relief by some exercises, we can get relief by some basic home remedies by which we can do basic positional changes and postural changes with the cervical spine. Now, in trigeminal area, we have to understand the basic supply of the trigeminal area. The basic supply of the trigeminal area arises from the goes. Second area is this, which is facial area, and third area is this, which is jawline area. So we will start the exercise program or the tender point release program with the basic maneuvers of the releasing tender points. In this part, we have to understand the tender points and their nature. If someone is having tender points,
sorry, yes. Your picture is frozen. So we didn't see anything you said in the last couple of minutes.
My picture is frozen. Okay.
Oh, now it's moving, but it was frozen when you were explaining the 3 points.
Well, yes. Now it is visible.
Frozen again.
Now it's clear. Now it's clear.
Keeps freezing, sorry.
Again, but I don't have any issues over here. So if it is clear, then I can explain again.
I don't know if it's just
Am I visible?
Or yes, you're visible, but it's like you're frozen, yes. You know, or maybe a delayed connection. Yeah.
Now I'm frozen or active.
Okay, sorry. Is anybody else experiencing the same problem, or is it just me, my internet? I don't know.
No, yeah, I'm experiencing the same as well.
Okay, could be some network issue.
It's not frozen now, though.
Now am I? Okay, so I'll explain it again. Okay. Now, if you see the trigeminal area or the neural supply is supplied on this area. You can see the area. I'm not going to mess with the muscular name or with the anatomical name. We will just move on with the basic maneuvers, basic methods of relieving the pain. So we have to understand the basic supply of the trigeminal nerve or the pain areas. We will target on the basic pain areas first, then we will move to the other pathological issues. So if the trigeminal neuralgia is there, so the supply of the trigeminal neuralgia comes from this side, goes to this side, first area, second to this, and third to the jawline. So first, we have to treat the area of the trunk. Area of the trunk is near the ear. If we will see the area of the trunk, which is near to the ear, we can see the some tender point over here by pressing, or there is some any hardness over the musculature area. That could be tender point or the muscles which got stiff due to trigeminal neuralgia or any other type of neural pain. So first we have to release that particular musculature area, and secondly, we will move to the MFR, which is myofascia release technique for the trigeminal neuralgia. So we have to check this area from up to down. If there is any hardness, there is any tender point, any point which is getting pain by your touch is known as tender point. We can see any tender point if you touch here. So you can see here is a tender point. You can feel that this is the point which is getting stiff. So we have to release this tender point with the clockwise movement 30 times. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. It's in a single motion. It is clockwise and in a single motion for the first point or near to the trunk or the nerve area, which is divided into three parts: first part, second part, and third part. Third part is supplied to the lower jaw line plus our lip line. So we have released the basic trunk area or the near trunk area for getting relief from trigeminal pain. That was the first. Now we will move to the second part. Second part is going through our face area. First was going to our head area, second is going to our face area, and third is going to the jawline area. We have done so many experiments, we have done so many trials on the patients. So if we control to this area, then this and this area automatically get resolved. So first we have to see near the trunk, and second we have to see the face area. The face area, which is the main central cheek area, we can say. So we have to move on the second area. In this second area, we will do a gentle massage with our two fingers. You can take two fingers or two middle fingers, by which we can release the muscle area towards the trunk area. Muscle area towards the trunk area. So we have to understand the mechanism and the intensity of that particular release. In this fascia release, it is very important to do all the movement from down to up. All the movement from down to up. Down to up. First, what we have done a clockwise movement for the first tender point or the stiff area. If someone is having no problem at the no any symptoms at the ear area or near the ear area, then directly you can do the simple clockwise gentle pressure for releasing or for activating the trunk. Sometimes trunk may get affected, or it can give you time pain for a few moments, but it's normal. So don't worry about that. First we have to release this, then second we have to target on the face area. Now in the face area, we have divided three parts. One is below the eye first, second is the central level, second is the central level, which you can see the nose level, and third is upper lip level. We had divided the three areas of that particular muscle. First is below the eye, second is nose level, and third is upper lip level. This area is up to that ear level. This is only this area up to the lower lip level. This is the second zone. You can see the second zone is this below the eyes and upper lip area from the lower lip. So you have to understand the basic mechanism and basic dividation of the particular nerve or the facial pain area. So first we have done the releasing of the basic trunk or the tender point or the muscle where we are getting stiff. Second is to release the muscle of the face. First we will release it from here, from down to up. 1, 2. It is having a little pressure, not much. 3, 4, 5, 6, 7, 8, 9, and 10. This is the first area of that myofascia release. Now the second area is at the level of nose. At the level of nose, we'll move with the level of nose here and upwards movement. 1. It is for identification, for marking only. So there is no need to pressurize your nose. And the point is not at nose. The point is near the nose, like this. 2, 3, 4, 5, 6, 7, 8, 9, and 10. That is the second. And in third one, we will move from a upper lip area. Upper lip area. This it was the second, that was the first, second, and third. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. We have done 3 zonal myofascia release for trigeminal pain. There is only 2 steps basic which we have done. First is to release the basic trunk, and second is to divide this area in 3 steps. After dividing in 3 steps, first is below the eye, second is at nose level, third is from upper lip level. 1, 2, and 3. We have divided all the 3 parts, and we have done 10 times repetition myofascia release for 10 seconds, or you can say the single repetition of 10 each. So what we have done, we have released the facial area for the pain of trigeminal nerve. Now we have to understand the trigeminal nerve area. The area is comprises of that zone, which is ophthalmic zone, maxillary zone, and third is mandible zone. So you can see in the maxillary zone, below eye is first segment, at the level of nose is second segment, and the level of upper lip is third segment. Third segment is very, very important. Sometimes we do all types of these exercises in facial palsy, the patient who are having paralysis in their facial area, which is also known as Bell's palsy. In Bell's palsy, the protocol is similar to the trigeminal neuralgia, but in trigeminal neuralgia, there is weakening of muscle, paining of muscle, but there is no any as such any paralysis of muscles. So there is a difference between Bell's palsy and trigeminal neuralgia. Now we will talk about sinus pain and the management of the sinus pain. Although sinus pain is a department of ENT physicians, so in ENT we can see due to sinus, there is a congestion or pain over the area of upper nose plus lower forehead area or upper eyelid area. This area is also known as sinus pain. If you will see, then I'll explain you with the closed eyes so you can understand better. If you can see that this area, upper nose, if the pain is going half of the upper side of the nose with combination of the upper eye pain, it could be sinus pain. Or if someone is having any allergic reaction or any reaction which is related to the any sinus issue, or he had diagnosed with sinus, then sinus pain remedy is very effective. Now, in sinus pain remedy, there is a basic phenomena of releasing the sinus. We cannot directly approach to the sinus of the face, so we will approach it indirectly, or we will release the localized muscle of the face which is paining due to sinus. In sinus, we will address the upper half of the nose area and the lower half of the forehead area. This area, which is in T shape, it is T shape. We have to understand the mechanism. It is T-shaped area. So what we'll start? We'll start with the releasing from our nose area. We have to give a gentle pressure and movements upward towards the forehead, like this. 1, 2, 3, 4, 5, 6. It is very gentle movement. It is very soothing movement. You don't need to press. You don't need to give more pressure. It's a gentle pressure with, you have to contact it from your half nose area, which is uppermost area. Just grip your nose like this. First you have to see the grip your nose like this and give a gentle pressure upwards and release. 1, 2, 3, 4, 5. From 1 to 10 times. Again we will do. We will start at 1, 2, 3, 4, and 5. 1, 2, 3, 4, and 5. We have to do from 1 to 10 at least 5 times. Maximum is 10 times. That is for the pain which is coming from a sinus problem. Next is second step. In second step, we have to release our lower forehead area from the nose area. In first, we have done from bottom midline to the nose towards the forehead. 1, 2, 3, 4, 5. That is for sinus pain, not for trigeminal pain. Again, I am repeating, that is for sinus pain. The pain in facial muscles, the muscles of the face, due to any sinus or any allergic issues which is related to the nose. You have to work on the basic root cause, but this is basic home remedies for relieving the pain. Now, after the first step, we will move to our second step. Second step is very important because it has to be done with both the hands. If someone is having sinus pain on one side, then also they have to do this exercise on the both sides, because we have to maintain the equilibrium, we have to maintain the balance on the both sides. Now, In the second side, the non-affected side, we have to give same pressure which we are giving on the affected side. On the affected side, we will give a gentle pressure. On both the sides, we will give a gentle pressure from the center to the sides. 1. See this very carefully because I am giving gentle stretch and pressure till the end. 2, 3, 4, 5, 6, 7, 8, 9, and 10. This is also 10 repetition in a single exercise. Now we have done 2 steps for trigeminal neuralgia, 2 steps for sinus pain. Now we will do 2 steps for temporomandibular joint pain. We have to understand the temporomandibular joint pain mechanism in the sound which is coming from our TMJ. There are so many patients who feel the pain over the ear, over the jaw area, or near the jaw area or the uppermost jaw line is known as TMJ pain. In TMJ pain, sometimes it goes to the cervical spine, sometimes it goes to the head area. So it could get associated with cervicogenic headache, it could get associated with cervical pain or the normal cervical mechanism, cervical spasmodic condition. In TMJ pain, some patients feel difference in bite. So first we have to correct difference in bite with the help of dentist. If someone is going under the dental treatment, so they can check their bite is it should be both side same. You can check your bite, it should be on both side same bite. If someone is having bite difference, one side a bigger bite, one side is a deep bite, one side is a short bite, so it could be the reason for their temporomandibular joint pain. Usually it occurs on single side, it occurs on right, either left side. So we will do these exercises on the affected side only. In trigeminal neuralgia, if patient is suffering from left side, then we will do exercise on the left side. If in TMJ pain, if the patient is having problem on the left side, then also we will do exercise on the left side. But in sinus, we have to do in a T-shape exercise. First was this, second was this. These exercises are not helpful for migraine or any headache issues. So we have to note this thing that these are not going to help you in your headache, and these are not related to the headache. These are exclusively exercises designed for the facial pain which are coming from the trigeminal neuralgia, TMG pain, or the sinus pain. We are addressing here only 3 issues. So don't merge other issues with these problems. They are not related to our eye pain, they are not related to our dental pain. So first in TMJ, first we have to see a bite. If a bite is normal, then it's fine. We can proceed with the exercise regime. If a bite is not fine, then we have to correct it with the help of dentist. It could be due to some dental problem or dental issues or the treatment which we are undergoing. So we have to address it first. After that, we will go to the TMJ correction or the pain area management by the exercise. We can only manage the pain. We cannot correct the TMJ issues. Dentist can correct the TMJ issues. In TMJ issues, there are 3 types of basic pain. First is half side of face pain. Second pain is during chewing, during the movement of the dental structures. Any movement of the dental structures goes pain over that area, over the TMJ area, temporomandibular joint area. And third is cervical pain related to the TMJ or the stiffness of the area related to the TMJ. So first we'll talk about the basic face pain, which is getting worst with the TMJ, with the deteriorated temporomandibular joint. We have to do three types of exercises in facial pain of TMJ. First is release from center to outwards. If I am having pain on left side, if I am having pain on left side, then I have to stretch my whole face towards my ear. What we were doing in trigeminal pain, we were doing trigeminal pain. It's a neural basic stretch or myofascial release. But in TMJ pain, we have to do a basic stretch with our palm. It is with pressure. So you can see I'm giving pressure with my palm, pressure, and stretch towards my ear. I have given stretch towards my ear. This is the first for half side face pain related to TMJ. Second is I have to put second exercise. In second exercise, I have to put a finger and see the dip in the mandible movement, in the dental or the mouth movement. You can see, you can feel the dip over here. This is the dip on the right side, on the left side. After you feel the dip on the left side or the affected side, you will stretch your face, you will stretch or you'll open your mouth like this with the gentle pressure. It should be on affected side only. With the gentle pressure, hold it 10 seconds. Close your mouth. Again, give a gentle pressure. Open your mouth. Ten seconds. Again, one more time. Open the mouth. When you will open your mouth, then your finger automatically get dip inwards. If the TMJ is on severe stage, then it will go more inside due to the degeneration of the joint. We have to start it from 5 times and keep it on 5, 6 repetition, 7 repetition. After 15 days, we will move to the 10 repetition. It was the second for TMJ pain. Now, third step for the TMJ pain is to stabilizing the joint, which is very important. In stabilizing the joint, we have to do a jaw movement in a single way, in a upper and lower way, and in a diagonal way. So first, please watch this carefully. That what I'm doing, then what are the movements. So it will be helpful in the exercises. I'm opening my mouth. It is a simple movement. Opening my mouth is a simple movement. Now I will do diagonal movement. It is a diagonal movement on my left side. Now I will do diagonal movement on my right side. So I have done 3 movements. First was a single center movement. Second was a diagonal movement towards the left. And the third was right diagonal movement. In these all movement, I had to make a limit. I have to make an area which limits the movement, and I'll do repetition with a gentle speed. Now I have limited this till here. I started from here and limit to this level. Start. 10 times. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Why I'm putting my hand below the jaw? Because I had to limit this movement, because that would be unlimited movement. Accessory muscles will work in this. I have to do the basic TMJ movement in initial stage. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. It was the first movement. Now, second diagonal movement or the side movement. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. It was on my left side. Now, third on my right side. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. These exercises was for basic TMJ pain. Now last, releasing technique for TMJ. It is not an exercise. Exercise we have done in 3 steps. Now releasing TMJ, how to release the temporomandibular joint. In releasing the temporomandibular joint, we have to grip our temporomandibular joint muscle over the TMJ joint. We have to grip all these muscles. We have to stretch it towards outside and hold it till 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Then release. Again, we have to grip. How I'm gripping? I'm gripping like this. We have to grip like this. Grip and stretch. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Then release. One more time. I'll stretch, stretch outwards. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. That was for the TMJ. You have to differentiate all types of pain first. If you are not going to differentiate, then you are not able to do all these exercises. You can do all these exercises in combination. These are really common and easy exercises to do. You can see the repeat video telecast. So by which you can do the exercises. You can use any moisturizer, any talcum powder or anything which is soothing to these exercises. And these exercises are really safe. If someone is having any history of facial surgery or any history of dental implanted, then it should get avoided. If dental implant is settled, there is no any issue in dental implant, then you can proceed with the dental implant also. Sometimes you may get relief in dental pain also by these exercises. So you can do these exercises. These are really helpful for toning the facial muscles also. If you want to tone your facial muscles, then also you can do these types of exercises. These are the main exercises. First for the trigeminal neuralgia, second was for the sinusitis, and third for the temporomandibular joint area of the facial muscle pain. Now, if someone is having any question, then they may ask.
Yes, good morning, doctor. Yeah, hello. I have some questions. The last exercise you showed, do we have to do on both sides of the face? The last one with stretching the muscles, pulling.
No stretching, only the affected side.
Oh, only the affected
all
side.
The exercises, yes, all the exercises we have to do on the affected side. Only the exercises which we are doing for the sinusitis or the pain which is coming from the sinusitis, if you are confirmed, then we have to do it on both the sides like this. Otherwise, all these exercises we have to do facial stretch or this stretch or the this stretch or pinching pressure. It's on the affected side only.
But then you said you could do it for your just as a normal facial exercises. Then how do
Yes,
we
facial exercises. Yes, for facial exercises without any pathology, for toning the facial muscles, you can do it on both sides.
both sides? Okay. So question then, how do you differentiate between the pain that could be coming from the grinding of the teeth? You know, at night when you grind your teeth, which of those
Yes,
three areas you said? Is it the mandibular, the bottom one that's affected?
yes,
Or
yes. Last one. Yes, it is related to temporomandibular joint because all the pain which is coming from a bite from grinding our teeth is related to the TMJ because this is the chief joint of our facial area which is related to our dental issues. So if you are addressing the grinding issues, it means it is related to our TMJ area. First, we have to correct your bite. Just get correct bite, get it done with your dentist, or you can see, you can check by with the help of mirror that your bite is going equal on the both side or not. Second, grinding. Third is chew. Then you have to do, then you can do these all exercises. But these exercises are safe. If you start these exercises, they will help you.
yeah, so I've been told I grind my teeth. So should I just do the mandibular, the last ones regularly?
Yes, temporomandibular joint exercises, TMJ exercises.
Yeah,
Yes,
do
you
them
should do. Yes, you should do,
regularly.
and you can. Yes, this will definitely going to help you a
Okay.
lot.
The other thing is when you get pain down your arm, is it coming
Yes,
from the spine or is it coming from one of those regions in the face from what you were
yes, it
explaining
is
today?
primarily. Yes, primarily it is related to the cervical spine. It is a spinal pain which is going in a neuralgic pain. So you have to address your cervical spine first, cervical spine treatment. Then you have to address the temporomandibular joint. That is a secondary issue. But sometimes it goes towards the cervical spine. Otherwise, TMJ pain goes upwards and in the face side only.
Okay. Okay. And the first few exercises you showed, how many repetitions do we have to do? The 10
10,
times
10.
one you showed. Yeah. So
Yes, yes.
how
10,
many
10
times?
repetition.
Just once,
One
10
time in a day.
times?
Just once
Once.
a day.
Oh, I see. Once a day, 10 times. Yeah.
Once a day, 10 times. Yes.
Okay. Thank you. Something was going, I was going to ask, but I forgot. Thank you.
No, no problem. No problem. You may ask in message.
Inside, we have no more questions. You already have addressed very simplified way. Thank you, Dr. Deepesh.
Actually,
Even if some
Dr. Neha,
yes,
sorry, I just remembered my question. Okay, I have
sure.
scleroderma, and I have been
Yeah.
told if I, because it affects your connective tissue and stiffens everything, and they always say
Yeah.
you might have difficulty later on with opening your mouth, you say. So, how can I
Yeah.
prevent? Which exercises should I do to prevent getting to that stage? Because at the moment, I
To
open my mouth.
Yes, in scleroderma, in advanced stages, you may feel difficulty in opening your mouth because it is a connective tissue disorder. In this, you have to address the joint range of motion of the temporomandibular joint because the TMJ is the only responsible joint for the opening of the mouth. So you can do all the movements which we have done in last steps of TMJ was first in a single movement and in the diagonal movement because they are responsible for the axis movement of the temporomandibular joint. So if you do all these exercises with the axis movement, center limit and side limits, though the joint range of motion will going to maintain
So, how many times should I do it daily?
10, 10 times, 10, 10 times. Not
10.
much opening. It's a limited opening like this. It's not like yawning or any other pose of yoga. It's simple opening because you have to maintain the lubrication, maintain the joint range of motion on the axis way.
Yeah, exactly. So I can start doing those daily. So I don't want, so I can continue my
Yes.
movement. Yeah. Thank you.
Yes, yes. Welcome.
Thank you, Dr. Deepesh. Thank you, everybody. If you still remember any question, we have a wonderful WhatsApp group, and Dr. Deepesh always answers and guides us through. I already have shared the recording link there. Hope see you all.